Cost increases in healthcare due to aging population, advances in technology, improving standards of living and better access to information are posing a challenge to the providers and payers of healthcare. At the same time, there is an increasing demand of evidence within the medical community. Evidence-based medicine means integrating clinical expertise with the best available scientific evidence to be used for the benefit of patients in a systematic manner. As a result of extensive research in the musculoskeletal field, systematic evaluation of that evidence and the application of practice guidelines, we already see that many past approaches which were questioned in the scientific research are now being replaced. The DBC devices have been designed for treatment and rehabilitation. They include specific features such as fine-tuned adjustments, precise targeting of the movement, possibility to limit range of motion and low friction of the moving parts, which make it possible to perform physiologically correct movements in a safe manner, even with the weakest patients. A typical phenomenon in low back pain is poor control, coordination and endurance of lumbar paraspinal muscles. In this lumbar extension device, the patient is seated in such a way that the lower body, limbs and pelvis is supported not to move, and the motion is taking place in the lumbar and lower thoracic spine, especially targeting the lumbar paraspinal muscles. Therefore, we can rebuild the functional capacity of this muscle group, which is necessary for normal function. Patients with severe neck pain often lose the ability to activate the deep neck muscles in a controlled way. Subsequently, they lose the normal control of neck movements. With this three-dimensional rotation device, we can re-educate the patient the physiological neck motion. Many shoulder patients suffer from rotator cuff dysfunction. In other words, the deep muscles around the shoulder joint do not work in a concerted way. With this glenohumeral rotation device, we can specifically train the rotator cuff. The DBC functional rehabilitation programs combine two key elements: progressive physical conditioning and so-called cognitive behavioral approach. They target at both physical and psychological factors involved in chronic musculoskeletal disorders. In more detail, the DBC treatment aims at restoring the patient's range of motion, restoring muscle coordination and movement control, improving muscle endurance and strength, improving general condition, re-educating the difference between normal physical loading and pain, reducing fears and avoidance behavior, also tackling the psychological, social and occupational obstacles to return to work when applicable, and also teaching the maintenance program what to do, how to remain active in order to secure long-term outcomes. As one of the fundamental issues, the DBC functional rehabilitation includes systematic quantification of pain, physical function and psychological factors, which drives the therapeutic process. Based on the assessments, the therapist provides individually designed, supervised progressive exercises, proper information about the underlying condition and its prognosis, and behavioral support towards overall activation and return to work. The tests that assess the severity of pain and impairment and measure physical function are periodically repeated during the treatment, thus allowing the scheduling of a correct therapeutic approach, giving the patient a feedback about the improvement and eventually documenting the outcomes.